Mr. Brewster?
Yes, Doc, we are on.
Okay, so let me know what you want me to do.
Right, so currently students are joining in, and in about 2 to 3 minutes, we will start. So what you could probably do is you could turn off your camera until your presentation.
I could do what?
You could turn off your video until the presentation.
No problems. Okay, so you can tell me when you're ready.
Sure. Good evening to everyone. My name is Devon Malcolm Brewster, Managing Director of Hyper Academics Jamaica Limited, host of this our second webinar for the academic year. Mine is a task to welcome all of you to this webinar at the Crossroads Clinical Training on the Horizon, an interactive webinar we hope for clinical students. However, we have extended the invitation to students who have just entered the program from year one, all the way up to students who are preparing to leave the program and enter the world of work in the medical field. And so we welcome all of you. We trust that for those who are still in the preclinical phase, you can see and hear and understand and ask questions that would help you position yourself in terms of what you should expect when once you join us at the clinical level. For those who are just starting clinicals, which should make up the bulk of students in our audience this evening, the third year medical students from the UWI Mona campus, as well as from the Kville campus, we trust that even as you prepare to embark on your clinical training, albeit largely online for the short term, just that you will take serious advantage of this opportunity to interact with and learn from the two featured speakers that we have for you this evening, and also for those students in fourth and fifth year who are already at the clinics or at the clinical level, preparing to return to the clinic, that you will, I suppose, receive some amount of reinforcement of what you should already know, what we should already know from our previous experience on the in the clinicals. It brings me great pleasure to welcome Dr. Althea Stewart, as well as Dr. Hilary Brown, who are consultant physician and surgeon respectively. And I look forward to their presentation to you this evening. I must also welcome Melissa Melojoy Flinch, who herself, like me, is a fourth year medical student, a member of the MBBS class of 2022 here at the Mona campus. Melissa Flinch is known for her exuberant personality and her ability to communicate effectively with people, to let people feel comfortable as a moderator, master of ceremony extraordinaire. And so we are very much happy to welcome her, and I am more so pleased to hand over the reins to her as we continue in this proceeding. So we trust that you will have a wonderful time. I know that Melissa will stress it again later, but I must stress to you that, you know, these opportunities don't come around very often, especially since, you know, things have changed since COVID. So take advantage of the opportunity as the presenters present, write down your questions. After each presentation, there will be some time for questioning. And at the end, there will be more extended time for questioning. Use the opportunity, unmute your microphone, raise your hands first and wait for acknowledgement, or type in the chat and make use of the time that Doctors Akart Stewart and Brown have committed from their busy schedules to help advance the work of medical education in the Caribbean, in Jamaica and the region by extension. So without further ado, I hand over to Melojoy.
Thank you so much. Is everyone able to hear me properly? Can you drop in the chat that you can hear me, please? Pretty, please. Love it. Yes, better now. All right. So again, good evening, everyone. We're so happy to have you, and we're so happy to have this. I remember when I was moving into clinical years, we didn't have an outlet like this. We didn't have a forum like this for us to be able to talk with consultants as to what to expect and how we can better prepare ourselves going in. Now, again, there is quite a difference between our space into the clinical years and yours, especially now since there's a global pandemic. How do we adjust to clinical years, especially with this in mind? Now, we noticed that it wasn't mentioned before, so I'm going to drop it quickly. Remember that we're also live on YouTube, so we'd like to thank our YouTube audience for being here with us. And I want to put a little special emphasis on those who are here on Zoom. So just in the moment, since we need a little warming up to remember that it's interactive, I want you to quickly drop what year group you're a part of right now. If it's class of 2K22, drop it. If it's class of 2K21, drop it. 23 is here. 22 is here. I'll wait. 22, 23, the best. 24 is all right. Who else we have? 2K23, 2K23. I see that 2K23 is dominating here with exclamation marks and everything. So I love it. You see this energy that we've started? We're going to keep it going, right? Yeah. All right, good. So now let's jump right into the introduction of our first presenter. And of course, we're so happy to have her. Dr. Althea Ackwart Stewart. She is a consultant physician at the University Hospital of the West Indies. And she's also associate lecturer in the Department of Medicine at University of the West Indies. Now, she did her undergraduate and postgraduate training at UWI-Mona and a fellowship in pulmonology with critical care at the University of Toronto University Health Network. Now, she is also a past president of the Association of Consultant Physicians of Jamaica. Now, according to the organizers, I'm not getting in trouble. According to the organizers, she is known to be a stern woman who proudly and vigorously defends the principled practice of old school medicine, not as one who rejects modern advancements in medicine, but as one who believes that the clinical acumen of a physician is unmatched by any modern inventions. So we have a lot to learn from her. Of course, I've been asked to add, of course, I'm not getting in trouble, that Dr. Stewart is known to be a defender also of the generation's methods and believes that the value of a doctor rests more importantly on his or her innate clinical acumen than their ability to maneuver machines. So we're going to see how much that comes out in her presentation, how much the importance of soft skills. Let me not go into it. I am not the one presenting. I am super excited for this. So without further ado, Dr. Ackwart Stewart, it is our absolute pleasure to have you. Please take it away.
Thank you very much. And you sound like the Energizer Bunny. I like the hype. Thank you so much to Devon and his team for asking me to come, for asking me to speak with you. He did say in his email that it could be spontaneous. So if I'm to be truthful, I did not do a PowerPoint presentation. So I hope that will be okay and that I won't lose 90% of you in the process. But I agree, I'm old school. I was taught by some of the best. They groomed me. They made me want to aspire to some serious heights. They made me love what I was doing. And they set the bar for me from the point of view that they made me want to reach that bar. They made me want to be the best at what I was training to be. Not to be mediocre, but to be the best. And this is what I would like to pass on to you. I will admit, I'll be upfront. COVID-19 has really and truly caused a huge dent in your clinical training. Because the truth is, clinical training cannot be learned with a Zoom presentation. Okay, I just did the IMP, Introduction to Medical Practice session with the students who are coming up now into clinical medicine. Junior clerkship is about to start. I feel that we are being unfair. We are cheating you out of learning opportunities because allowing you to watch a video is not the same thing as having your hands on the patient and examining the patient. But I gather from our last departmental meeting there might be some changes in that small group sessions may be allowed in the very near future. There are people who I have had in my career who have taken me to the heights. And to show you how bad it was, at one stage in my career, I wanted to be an obstetrician and gynecologist. At another stage, I wanted to be a dermatologist. And then I met somebody who made me see the joy and passion of internal medicine. So hence, I'm an internist. And as an internist, my job is to put together the facts. I keep on talking about taking a good history, and also to be able to put together the facts and put it all together to make a diagnosis. And as the first person who introduced me said, my Energizer Bunny, I feel like a nerd in trying to take this message across, because you are all millennials, you are 20th century people who, you just do a full body CT, you just do a full body MRI. Why do I need to listen to take a history? Why do I need to go through all of the things of examining? Because all I can do is do a full body MRI and I have the answers. But what I want to get to you in the crux of this medical practice, in the crux of clinical medicine, is you have to use your brain. You have to be able to assimilate the history with the clinical findings, and put it all together. And the MRI, the CT scan, the echo is going to prove what you have already decided is factual. This must be it. And you see, you have to develop a certain level of confidence. Confidence is key. Yeah, because you need to be able to interpret that MRI, but your history is what is going to guide you. That yes, and your examination, this is where the problem is. And it is honing your craft, which only comes, I'm sorry to tell you, and I feel like a nerd, and I'm not techie enough, but it only comes with practice. But you see something, you see when you're good at it, you see when you have mastered it, you see when you have learned to interact with your patients, you see when your good clinical acumen saves life. Trust me, there is nothing that is more gratifying than the fact that you have made this difference in this patient's life. Okay? And that's the orgasm I want you to have. That's the height I want you to reach, because it is so precious. I find the online teaching, you also have to prepare more for it. The online teaching is difficult because sometimes even when I ask cameras on, there is lack of attention from the students. You're distracted depending on the environment in which you are in when you are logging on. You're easily saturated, and when you miss points, I'm not able to see the people to realize, oh, you haven't understood what I've said. Because even though your cameras are on, most of the times, I can see you're saturated. Then there's a big problem of unreliable internet connectivity. So how do we satisfactorily teach a hands-on course going online? I am struggling with it, and I'm having great problems. What's going to happen to us, and what has already started, is that the last group who just did their exams in July, they had a diluted exam, a diluted clinical exam, because of the fact that there was insufficient hands-on in the latter part of their training. more so for you guys who will be doing it in 2021, 2022, you're going to have to some extent, a diluted clinical exam. You have lost out on your practical skills. Not only is it that you have lost how to interact with patients, how to be able to get the information out to the patient, you have also lost your interactive skills with other members of the health team, because those things are important. You have also, what you are coming out with is somebody who is textbook smart, but not practically competent. And that is really very unfortunate, because your clinical skills have got to be developed in order to make you a good clinician. Another thing that you are missing out on is developing your professionalism, how you learn to approach patients, how you learn to approach your colleagues, the nurse, learning to say good morning, automatically making your colleague look up and know that, yes, you are here, you're asking something. Those are skills that you need to acquire in order to be able to achieve or accomplish what you want on the wards or in the management of the patients. So how do we take it from here? Because the reality is that this online business is going to be the way of life for another couple of months. However, I did say before that we may soon be having small group sessions where you'll be allowed observing the protocols of hand washing, observing the protocols of proper masks. You may soon be allowed back on the wards in small groups. This time, I think that when you come back, I think having been so starved, so parched from a lack of clinical experience, that most of you will now take this seriously. Because if truth be told, some of you used to skive off, gone library, gone here, gone there, gone all over the place, and did not, in times that allowed, spent the quality time on the wards that you should have spent. Now that you're coming back starved, I think when the small group sessions resume, you will put all your energy into it to get the most out of the patient-doctor interaction. I see Bianca saying it's true. I know when I took the register, where is, oh, not here today. Oh, had a doctor's appointment. Now you will understand the value of this opportunity because you have been so starved of it. Next thing is that I would strongly advise you is that the small group interactions as well can come among yourselves. You may not be able to come on the wards as a full class, but small group interactions can come among yourselves in this same hyper academic group. You arrange that on a Thursday afternoon at 2 o'clock, 6 of us are going to do respiratory exam. You examine on each other, observing the protocols of hand washing and mask wear when you can. Because one of the things that I'm finding for the poor IMP students, and it's going to be worse for the junior students who are coming up in a little while, it's so much to remember. When I start, okay, so I start to inspect, then I start to palpate. Okay, after I do the chest expansion, what I must do next? Oh, it's percussion. After I do percussion, what do I do next? It's tactile vocal fremitus. You need to, and until you do this, and as often as you do it, it becomes second nature, then you don't need to think what comes next. You just do it. So what I'm saying is that small group sessions, as will be allowed on the wards, but small group sessions within your own organization can be arranged, that you can now go ahead and practice with the observing of your hand washing and your masks, practice on each other so that you get the flow of the examination techniques. You get to, you become familiar, you know how to percuss, you know how to examine, you know how to interpret. It's one thing now to be able to do the physical thing, but having done it and elicited your signs, you now need to be able to put it together to decide, well, does this mean the patient have a pleural effusion? Because there is stony dullness on one side of the chest, the stony dullness is on the right side, and the trachea is pushed over to the left and the vocal resonance is gone. Because putting it together is key. It is key. And this is where I cannot overemphasize. When you are able to put it together, you come with confidence because you know what you are doing. When you go out into the world as doctors, I would like to remind you that some of you will not be lucky enough to work in situations where the full body MRI and the full body CT is available. Some of us are going to be working in conditions where nothing is available, nothing is there but your head, your brain, your hands, your stethoscope. And you are going to say, well, I will never ever reach that back of wall place. Well, you never know what life has in store. And this is why it is important at this stage to hone the skills, develop the acumen so that you are able to have the clinical acumen to decide this is an emergency. This is what is wrong. This patient needs intervention now. And then the other personal thing that is part of your development, because medicine is textbook. Medicine is also interpersonal skills. Because not only do you have to relate to the patient to gain that patient's confidence, to spill out all the information of how many sexual partners they have had, if they were HIV positive, how many children, how much they smoke, how much chalice you need to get that confidence. But also, in order to achieve, you need to develop the interpersonal professional skills with your colleagues so that everybody will fall in line and the team will function as a team, because what we are here for is the healthcare of the patient. I'm going to pause because I don't want to bore you to tears. And I'm going to ask if there are any questions. I'm happy to answer.
All right, so persons, we're being asked if you have any questions just to drop them in the chat, or feel free to turn on your mic. I see Jason, you have a question? Feel free to go ahead.
Jason, turn on your mic. Mic not working.
All right, I'll read for you. But just while we're waiting, Doc, we really appreciate the conversation that's happening so far. I remember that it was actually when we went to clinicals that a lot of the things that we learned in class actually started to make complete sense. You know, the pieces started fitting together. So a conversation of figuring out how to make the most out of the situation, even as it is very important right now. Jason, I trust that you are typing in the meantime.
Can I say something, Melissa? As an old schooler, what you are having now, what you are supposed to be getting is a foundation. the foundation that you get in those early years. So that when I talk about a DVT in the proximal veins, you know that the proximal veins are the popliteal veins, the iliofemoral veins, etc. When you come up to the hospital now and you start the clinical work, you are building the house on a foundation that you have laid. But guess what? And everybody will tell you this, the house is not finished till you do a clerkship called Path and Micro-B. When you do Path and Micro-B now, that's when all the scales, it's like the blind man that Jesus healed. All the scales are removed, I can see, because now it all comes together. You understand? But in blending in all of that is the fact that you have to be able to examine, to take a good history, to tease out the history so that you know, this is where the problem is. He's having coughing and shortness of breath. He was a smoker. He has lost weight. The number one diagnosis is either COPD or possibly bronchogenic carcinoma. Okay, I see a question from DV. Clinicals will restart. Yes. My last word at the departmental meeting was that we were going to eventually start back small groups on the wards. Now, I cannot say to you exactly when it's going to start, because I know the junior clerkship starts soon. And I think there are going to be mainly through Zoom. God only knows how that is going to work. But I also know that the seniors, there is some discussion about having the senior students back in small groups. So don't hold me to it, but that's when I'm exactly when it's to start. Jason's question is in the chat.
Let me read that question quickly. So Jason is asking, how do we deal with a patient if they don't want a student to work with them?
I agree, Jason. And Jason, that has been a problem more so in the past, because remember, there was a time when we had not only junior students, IMP students, senior students, nursing students. The patients felt bombarded. I would ask you in that always be respectful, because the patient has a right to say no. This is why before you approach the patient, we're always talking about introducing yourself to the patient and explaining what it is you're going to do. If the patient says no, you have to respect their wish. What you do, you push the envelope a little bit. Can I come back at a later time when it's more convenient? If they say yes, well, you're gone clear. If they say no, well, then you have to respect that. You ask your senior or ask your consultant if they could assist you with finding somebody else who would be cooperative. I hope that answers.
Another question. Oh, is someone speaking? No. Okay, there's another question from YouTube. Someone's asking, how do students avoid burnout?
How do students avoid burnout? I think burnout is something that all of us experience at some point in time. Medicine requires a serious level of planning of time. You have to organize your time well. Time management is key. And you need to know how you learn. One of the things that I find happening, and it happened when I was a student, and it still happens. You would be in a group, and there's somebody in the group who just spewing knowledge, man, spewing. And he just appear at the right time to ask the right question. And you would feel so overwhelmed that you don't know nothing. Sometimes, one of the things you need to recognize, sometimes that person is just a big old show off. And it doesn't mean that that person is going to be a better doctor than you. You'd be surprised. You probably have other skills that other student does not have. You have to plan your time. In that time management, you need to be able to make sure you factor in sleep, you make your proper nutrition, a little exercise. You need to know you need to be able to know what are your best study times. My best study times are like about 2 o'clock to 6 o'clock in the mornings. I am a morning person. You work out which is best for you, and you guard that time maliciously so that people don't intrude. You might be a snob, you might be whatever, but if you work out what is best for you, factoring sleep, factoring nutrition, factoring God, because you have to have that anchor to keep you going, to keep you re-energized. I am not saying you will not have burnout, but it will not be as onerous as it would be if you did not have a structured plan to how to get things done.
All right, thank you. So I remember you had said that you were not finished, so we're just going to continue into the latter part of your presentation. Oh, I see one more question. Let's just deal with that before we continue. The question says, what will students or faculty do if we students come in contact with a COVID positive patient during our clinicals and become infected, in brackets, for instance,
this
someone
is
in the
exactly why everything has come to a standstill. This is exactly why that fear of you coming in contact with a COVID positive patient and becoming ill has led to a total shutdown of your clinical life. That's the reason why. Because of the fact that we don't want to lose anybody. We don't want anybody to die from being exposed to COVID-19. So this is why that fear, why we have shut everything down. And guess what? That is going to be a problem even in months to come, because while the actual numbers appear to be decreasing, there are still going to be people that you will meet who are going to be positive. But what I have to say to you is a very rude awakening. This is medicine. This is medicine. So this is why when you are taking blood, you are going to be coming in contact with a person who has hepatitis B or hepatitis C or HIV. You take precautions. And this is something that is integral to your future training as a clinician. You must take precautions. This is a hazardous life or hazardous career that you have chosen. That's the reality. It was similar when we had the influenza outbreak of the H1N1 virus. And that was about 2 years ago. What are you going to do? Take your flu shot to try and get your protection. Do your immunizations as part of your protection. But your life from henceforth as a clinician is going to involve exposure to infectious diseases. So we recognize the fact that you are young. You need to be groomed how to take precautions and not be cavalier. So until we are satisfied, I think, that the numbers are going down and nobody is exposed, either you will not be able to come or we do very small. I just saw a question from somebody. Dying before I start living is a terrifying thought. I agree with you. That is a terrifying thought. But can I also say to you that even when you finish this course, this training, you are going to be exposed. So you need to learn from now how to take your precautions. It may not be COVID-19 when you start living. It may be something else, but you need to learn these are precautions I must take as a clinician. That's not going to change.
Love it. Are there any words that you'd like to leave us with as we're moving forward in the presentation? Just summing it up, that one major thing that you think that as students we would need to keep in mind, especially those now transitioning to clinicals.
The people who are now transitioning to the clinical exam, to the clinical aspect of training, push yourself. I said to you, that's part of the solution. Right now, we're doing videos until the dean and the faculty has sorted out when the small groups are going to resume. Push yourselves. If it's in a group, if you have 10 of you in a group and 5 of you, you find 5 friends of similar mindset, you meet together, you have on your masks and you practice the examination. Go through the videos together, practice the technique for examination, go through read the topics and discuss. Now is the time when you have to show your own initiative. You have to practice. Unfortunately, that is one aspect of the clinical part that you'll have to do using your initiative. But the other aspects about the practical skills, that won't be able to come. How many of you can put in an IV? How many can take an arterial blood gas? We just have to wait until the safe time comes to do that. But use your initiative, be disciplined, try to get a group that will work together, not chat and laugh and watch YouTube and check different on social media, but genuinely work together to try to see how we can get this thing right among us.
Dr. Ackroyd Stewart, we thank you so much for giving your time and energy to us. We thank you so much for answering questions. We've noticed how interactive the group has been thus far, and I know they'll have more questions boiling, so we'll pass them to you as we go along. Speaking of passing, I'm going to be passing the presentation over to Mr. Devon Malcolm Brewster. I'm seeing on our program that there's a short presentation. So I'm just gonna move over to him and then we'll continue the program.
Sure.
Okay, good evening to everybody once again. For those who joined late, my name is Devon Malcolm Brewster, Managing Director of Hyper Academics Jamaica Limited, to whom this webinar has been made possible. Just before we transition into the presentation of Dr. Hilary Brown, I just want to pause to make a very brief presentation. Let me first of all echo the sentiments of Melissa in thanking Dr. Althea Ackroyd Stewart for such a riveting presentation. Hyperacademics consist of a group of young persons, all medical students who have found it necessary to amalgamate our thoughts, our competencies, and our linkages with medical doctors as well as other students across the UE network to bring together a host of resources that will best be able to help medical students succeed. There is no way to overstate the extent to which the medical program is a heavy program. It is not one for the faint-hearted. It is one that requires a lot from us. And so it is very much important that we get as much help as we need. And no one is better to lead that force more than medical students themselves. And so Hyperacademics, having started in 2018 as a sole proprietorship, would have been recently incorporated as a limited liability company, the only one led by students in this market. And so we are strategizing and positioning ourselves to continue to serve the needs of medical students, paying close attention to the gap that exists in terms of the socioeconomic realities of students that limit the access to many students to premium resources that are available on the internet and through various means that can help augment the medical education. And so over the last couple months, we through our strategic partnerships with different individuals and other companies have been able to put together different packages and be able to help students in ways that exceed values of over 200,000 Jamaican dollars since the start of the year. And most recently, after hearing the cries of students publicly, privately in the media, Hyper Academics has been able to, through again our strategic partnerships, to source PPE equipment for students at significantly low prices and so forth. And so we continue to strategize and enable and amalgamate and bring together resources to help students. And one such is the clinical incubator that we will soon be rolling out, which stems from something similar to what Dr. Arthur Stewart mentioned in a presentation, being able to come together, to work together as students to help build up each other. And so the clinical incubator has three aspects, one being clinical rounds, which is basically where we have other students and medical doctors walking students in medicine, surgery, and pediatrics through different case studies and helping students to understand how it is that we treat with patients from the time they walk in and hopefully to the time that they exit the hospital. Unfortunately, it may sometimes result in demise, but we all strive to do no harm and ensure that when patients leave the hospital, they are well again or well on their way. The incubator will include daily discussions on the subject matters to help facilitate active recall, and basically to also enable exam simulations that will help students better prepare for how it is that the university plans to examine you even in these COVID times. And so we invite you to follow us on Instagram at Hyper Academics to learn more and to get more information as we continue to help bring together resources. This webinar is one testament to that, and you can look out for more webinars where we will bring together different consultants, different persons across the medical field to help advance your knowledge. Where the clinical incubator is concerned, we know that it's COVID times are hard, things are different. We are not in the clinics, but Hyper Academics, through our strategic partnerships, are prepared to bring the clinics to you. And so without any further ado, I will hand back over to Melojoy as we transition into the presentation of Dr. Hilary Brown.
All right, we love it. Thank you so much, Devon. Thank you again for what you're doing, especially through your company, to ensure that our transition, as we go through this, the current conditions, are as smooth as possible. Now, we've had a great presentation before by Dr. Eckhart Stewart, where we learned so much. We learned how much the clinical years actually helped to cement the ideas that we've been learning in the first 2 years. We're highlighting how the soft skills, the ability to interact, the understanding of what it means to be professional and to interact properly with our patients comes to the forefront. Now, she's hoping that with this starvation that we've had, that when we finally get actually back onto the clinicals, we'll have a certain drive that allows us to, in certain senses, make up for lost time, while at the same time developing the drive right now so that when we get there, it's smooth sailing. Now, our next presenter is Dr. Hilary Brown, and she completed an undergraduate degree in medical school at the University of Pennsylvania. She then went on to training in general surgery at Yale University. Now she has worked as a consultant general surgeon at the University Hospital of the West Indies and returned to Yale University to complete specialization in vascular surgery. Now she has recently returned to Jamaica and is also employed as a lecturer and consultant surgeon at the University of the West Indies. Now, she's also co-owner of Vein Centers of Jamaica, located at 80 Lady Musgrave Road, in brackets, I'm saying this is not a commercial, giggles. I refuse to giggle. I giggled. All right, so she is also co-owner of Vein Centers of Jamaica, located at 80 Lady Musgrave Road. And she's also active and vocal on the political landscape and encourages everyone to be politically aware. Now, we are excited to hear what she has to say. So without further ado, Dr. Hilary Brown, please take it away. All right. Well, Dr. Hillary, there we go.
All right. Good evening, team. I can't see myself. Can you see me?
We sure can.
All right.
Yes,
That's
we
a little.
can, Hillary.
All right. That's a little disturbing since I don't know how I look. But anyway. Okay. So I joined just in the last part of Dr. Akar speaking to you. So I don't think it's going to be necessary to go over some of the stuff she spoke about, but I'll just give this little bit more of a perspective towards surgery, since you're obviously going to be doing both medical and surgical rotations when you come into the clinic. So the first thing I'd like to say before we even get to COVID, the first thing I'd like to say is that however you begin or embark upon your medical career at this point in time is probably the kind of clinician that you're going to be. So I think it's very important to develop good skills from now and good practices as to how you're going to approach your patients. And that starts with things as simple as, and I'm highlighting these things because these are issues that we have with medical students. And so I'm highlighting these issues. This starts with things as simple as getting to ward rounds on time. And if you respect the fact that you're supposed to be at ward rounds at a particular time,